It's Aaron Malloy here and welcoming you to a very special edition here. It's edgeradioaustralia.com and we've got a bit of a special report happening today. Now, normally you can listen to me chatting on, but today I'm going to be very, very quiet. The fact of the matter is we've got some incredibly important guests in. I've got Derek Whittaker to my left. Welcome, Derek. Thanks for being here.
Thanks
very
for
much.
having me.
Now, mate, you've got the keys to Edge today. Simple as that. I'll get you to introduce our absolutely amazing guests and we'll go from there. Very, very, very special guests. And let's do this.
Aaron, thank you. Look, a very important topic today, and it's one that's affected all Australians, and not only Australians, but people globally and around the world. And of course, I'm speaking of the mandated vaccines that were put, of course, over the last couple of years. Let's put it in context. In February of 2021, Pfizer was expecting to sell $15 billion worth of COVID-19 vaccines, with total earnings expected to be between $59 billion and $61 billion, up from $42 billion it made in 2020. And with the exclusion of the vaccine, the company expected its sales to grow 6% in the year 2021. In recent months, in 2022, we saw an admission in front of the European Union's investigation into the response to COVID-19, one of the directors of Pfizer admitting that the vaccine was ineffective in stopping the transmission of the virus and that it had to be made at, as they put it, at the speed of science.
And I will speak in English so there are no misunderstandings. Was the Pfizer COVID vaccine tested on stopping the transmission of the virus before it entered the market? If not, please say it clearly. If yes, are you willing to share the data with this committee? And I really want a straight answer, yes or no, and I'm looking forward to it. Thank you very much.
Regarding the question around, did we know about stopping immunisation before it's entered the market? No. We had to really move at the speed of science.
Australia alone spent over $8 billion on vaccines and administered in 2021 42.6 million doses. Now, to put that in perspective, our population is just under 26 million people. And governments, particularly in Australia, have had a heavy-handed approach in mandating these vaccines, forcing its citizens to be vaccinated, even in industries with no direct link to the health industry. I'm joined by two very special guests today. Melissa McAtee, a former manufacturing quality auditor for Pfizer, and now a whistleblower, as she puts herself, and has fascinating evidence she's gathered while working at the manufacturing plant of the Pfizer's vaccines. And Senator Malcolm Roberts from One Nation, who's made numerous calls on the government for greater accountability when it comes to the freedom of choice when it came to the vaccines. Melissa, thank you, and Malcolm, Senator Malcolm, thank you both for joining us today. Melissa, I'd like to start with you. As a manufacturing quality auditor for Pfizer, what did your role actually involve day to day?
Daily, what we were responsible for was we would have to walk the entire plant, essentially. We would give lines the permission to start. We were in charge of product getting out of the plant. If there was any issues, we would have to put holds on them. But one of the key parts of my jobs was auditing, which was you go into a room where a product is being inspected, whether by people or by a machine, and we kind of look at product that has already been looked at to see if they missed anything. And if they missed something, then there's steps and procedures to resolving that, whether the product can move forward or if there has to be a reinspection, different things like that. Basically, we have to make sure the rules are followed, that protocols, all the special paperwork is done. And we also kind of have to know the job of the entire plant. We don't have to do it, but we have to know it, because if somebody is operating out of quality procedures, we have to address it.
How long were you in this particular role?
I was hired in, promoted in 2017 to the position from a pharmaceutical assistant, which was basically a packaging assistant. But I was hired in 2012 under the name of Hospira, but Pfizer bought it out in 2015.
Awesome. Okay, thank you for that. What was happening in Pfizer when they announced they were going to create a vaccine for COVID-19? Did you see this swift, this change when it came around in 2020, when the world started hearing about Wuhan and the lab in 2019? When was it on the radar as far as Pfizer was concerned?
I actually started to get a little skeptical of their ethics in 2019 and around the springtime, summertime. But it wasn't related to necessarily vaccines and stuff. It's just they had strong pushes to get things out, even if there was quality issues. But when 2020 rolled around and they announced that Pfizer would be producing a vaccine, many of us were excited because, of course, we thought that meant, more money for the employees as well. And just we thought we'd be helping the world. That's kind of what we thought. Very few people were skeptical at first. There was a couple that questioned, the speed of it, what was going on, and things like that. But for the majority, most people were excited about it to be able to help produce it.
So when did you start to become skeptical? What apart from when the actual vaccines were concerned, what put something on your radar saying something's not right here? What was it?
Well, really just when they started kind of framing it as this saving thing that was coming along, like something that could save us. That was kind of a little odd. And then I was even going to consider getting it myself, but me and my husband agreed that we would wait until we started producing it within my plant to see if there's anything sketchy going on with it. And then when I saw the glowing vials, that was probably the first time that I realized I think my company is being deceitful.
Wow. Can we go into that? What do you mean by glowing vials?
Do you mind if I show you?
I would love you to, please. Yes.
Yes. This is my work badge. My photo was taken when I was hired when I was about 19 years old. I worked there 10 years, so I just turned 30. So I'm pretty young here, but this is my badge. This is a controlled vault key that shows I have access to controlled product. This here is the back of the badge. It shows it's Pfizer property, and my CDA sticker that shows I can work with controlled drugs.
Okay.
And then this here is regular product. This is not the vaccine. This is what everyday today product looks like. And the reason I have this to show you is because the vaccine, the next picture I show you is the vaccine, and it's on this same table with the same lighting that's around, and it has the same color cap as this product does, but this is not the vaccine. This is just to show that the color is no way affected by the reflection of the color of the cap. So the cap here is purple.
Certainly.
But the vaccine, this is what it is. This is the vaccine here.
Okay.
And it glows.
And that
And the only thing that changes here is the dark background. It has to have something darker than white behind it.
And this is for people who, obviously, the majority of us are untrained eyes in looking at vaccines. This is not normal.
Not at all.
Okay, so this was the thing that put things on the alarm bells for you. What does this mean from from a drug lab perspective? Why does this set off alarm bells for you?
Well, it set off alarms for me because I've looked at millions of units, and there's never been anything that looks quite like this or behaves like this, because it does color shift. When it is on the white side, it is clear to a very slight yellow in color. That's normal. That's fairly normal. If there was no change, I wouldn't have thought anything, honestly. But when you switch it to the black side, it glows and it changes colors, which if that was normal, it would be documented on the regular paperwork that goes with every type of product we run. So as a quality auditor, we have a piece of paper that says what the product should look like, what the packaging should look like, so that if anything deviates from that, we know it's a quality issue.
Right.
So if something's supposed to be clear and it's yellow, there may be some oxidation in there, or there may be some something not right that needs further investigation. But with this, it said in the description that it was clear to a slight yellow. So when I brought the attention up and I said, hey, this actually glows blue, they said, ignore it, basically.
Wow.
Like, nobody cares. Wow. Like, that was basically it, like, move on. And I thought that was really odd. I had talked to people who'd been in the plant for 40 plus years who said they have never seen anything that looks like this or gets treated like this vaccine does, because this vaccine was arriving pre-mixed in bags from China.
Oh, wow.
Okay, so you're saying to us, just to make that clear, this mixture was being made in China, not in the United States.
Correct.
Right.
Well, at least that's what the people interpret, because they couldn't read Chinese.
My jaw is on the ground at this.
So you're saying to us, just to be really clear, that the ingredients or the mixtures were coming from China in Cantonese or Mandarin writing into the United States. And how were you, what was your role as far as the lab is concerned? Why weren't they just being shipped out straight from China? Why were they coming into the lab here in Kansas?
Well, something that I thought was interesting was it didn't list my plant as manufacturing the vaccine, which I thought was odd because, well, to my knowledge, we were. But then when I talked to people from incoming quality, people who received this stuff, like the glass, the caps, different things from other suppliers that we don't make, that we need to make the product, they said that it came in bags that didn't have English markings. The only writings that were identifiable were Chinese. They bring that into the plant. Then it gets mixed within a tank, a solution tank, where it looks kind of like just a big metal tank where they mix the medicine. And then it goes to the fill line where it gets placed in the vials. And then it goes to light inspection, and then packaging, and then shipment.
Okay.
Right.
So it's not normal.
Okay.
Let's talk about this a little bit, because there's been a lot of speculation in terms of what is actually in these vaccines. If this thing is luciferase, what does that imply?
You know, what it's normally used for is for testing purposes outside the body, usually in, mice or petri dishes, different things like that. But in this case, the only thing I can think of literally is just like to know who's received a vaccine, or if maybe like, because this is an experimental thing, maybe it's to see, maybe if somebody gets this and dies, they can go look and see why. I've also heard other suggestions as to why this glows that I could get on board with, which would be the nanotechnology, which I do know is in there. And or cesium-137 is something I've been hearing lately, which is like a radioactive type thing.
Let's just talk about the process of manufacturing these vaccines. There is the testing and development stage, and then there is the actual manufacturing for distribution stage. The sample that you're showing on this picture, which stage was this at in terms of that process?
This was at the light test stage that I took these photos, which is when it had it gets finished in the filling process where the liquid goes into the vial and it gets capped and sealed. And then it goes to a room where it gets offloaded onto a machine. A machine sends electrical impulses into it to see if there's any cracks, seals that aren't properly done, different things like that. And it also has a camera that takes a bunch of pictures to look for things that are in there that shouldn't be, such as, glass, metal, everyday things. Yes, there's a lot of glass and metal and hairs, different things like that get into the vials, different products. And so that's what it's looking for. Well, then once the machine's done looking at it, it gets offloaded, ready to go to packaging, but quality has to come in, take so many samples, look at them to see if it missed anything. And if it did, it's a failure, and the product gets put on hold.
So this is all this is to the end result is this is for distribution. So this is not test and development and
No.
science end. This is the manufacturing end.
Yes, the manufacturing part, yes.
Thank you for that. All right, in terms of graphene oxide, you mentioned that before. Tell us a little bit about that, because a lot of people aren't familiar with what the graphene oxide can do.
So to my knowledge, graphene oxide is part of the mechanism that would be used within the shots to assemble into, I've seen different pieces of evidence that show it turns into like a Wi-Fi network within the body to emit a Bluetooth signal. I can't prove that, but that's something I've seen other people say that I trust, that I think they're fairly accurate. I know that it's toxic to people in certain doses. And I actually do have some graphene oxide emails if you would like me to show that as well from within the company.
Yes, please.
So this is an email from a woman named Sandra, and she's in communication. She's a medical information specialist. You can see at the bottom, and she's in the United Kingdom. And she was receiving a lot of questions regarding graphene oxide being in the final product. And so she emails a higher up person named Steve to ask if the question is okay, or the answer is okay for the question. And her proposed answer for the question is graphene oxide. And the vaccine is graphene oxide is not used during the manufacturing of the vaccine, and the final product does not contain graphene oxide. We cannot guarantee that minute amounts of substances are not contained in raw materials obtained from our suppliers. To ensure we have a consistent, reliable supply of medications, we must use a network of suppliers and manufacturing sites globally for both active and inactive ingredients. To me, this is all China here.
Okay.
It's basically saying we can't see it's not in there because we get a lot of our supplies from around the world.
Right.
All right. So this is a denial that graphene oxide is in it. Yep.
It can be, is basically what it says. Yes, that they can't guarantee it's not in there. But what's even more odd is the response that she gets from Steve. And he says, it would obviously be preferred to not add the second sentence, we cannot guarantee, but it is our common disclaimer to protect against any ingredients that may be in raw materials that we do not confirm against in any way. If we have the ability to specifically omit it, we should, but it would likely require some extensive confirmation from GCMC. But I think that is the statement we should go with for now. Hopefully our customers would appropriately consider the disclaimer in the right way. So he just says, just say it's not in there.
Wow. Okay.
That's his response.
Okay.
All right. In terms of these vaccines have been promoted as using mRNA technology. Talk a little bit about this. Explain this to us in terms of your understanding what this does in these vaccines.
So how my layman's understanding, just from research and things I've seen in my own documents that I have found on their database, it is a delivery system, a messenger protein or instruction manual that basically gets delivered to the cell to instruct your cell to do something it wasn't already doing. Now, I believe that the mRNA is paired with CRISPR-Cas9 technology in order to edit the gene or DNA.
Now, this has huge implications, as I understand it, excuse me, as I understand it, for people's autoimmune systems in terms of how the body can later respond to it. It accepts it rather than rejecting anything foreign matter that the body would naturally fight. Is that your understanding of that?
Somewhat, yeah.
Okay, can you expound a little bit more on your understanding of that, please?
So basically, Pfizer frames it up as a good thing, that they can get rid of cancerous genes, that they can get rid of a gene that causes problems, things like that. So they frame it up as good, but you're basically playing mad scientist to do it. I mean, you basically have to give it to people to find out if it's going to work. And even then, you have to trust the people who are developing it and giving it to you that it's not going to do something outside of your consent.
To me, that sounds like Russian roulette with your DNA.
Yeah, they basically had to do a massive study, and I believe we've seen that since the rollout of it.
I'd like to get back to the evidence that you have here, Melissa. Can you take us through other documents that raised alarm bells for you? Take us on your journey in terms of these discoveries, please.
Well, I do have a short little video here that I took myself. As a quality auditor, they've told us from the beginning that, you've got to be seen at all times. Even the rooms that do visual inspection that are light test training, they're just tinted. They're not blacked out. Like you can walk up to the window and still see who's in the room and what they're doing. Okay. It's just slightly tinted to help with if they need the lights off. To do the inspections, and then in which case you're sitting at a lit booth, so you're still visible. But anyways, the day I found the documents was August 20th, 2021, and I went down to the lines and I noticed that they were blacking out windows on the path of the FDA. So I'll show that real quick. You can see there's one blacked out there,
Yep.
2, 3,
Melissa, had
4
you ever
blacked
seen,
out windows.
had you ever seen this done before in your time there?
No,
Okay.
no.
Was there any reason that they were blacked out? Was any reason given?
Well, as you can see here, that's a fill tank, by the way, as I was describing earlier, what they put the product in. But this shows what the windows normally look like. They're normally just clear. And then this room here that I pass is a group lead office where they just do paperwork for batches.
Okay.
So after I saw this, I actually saw 2 different supervisors in the halls. There was one who was actively in that group lead office. And when I asked him, why are they blacking out the windows down here? His response was, so the FDA can't see me taking a nap in here. And I looked at him and I said, nice integrity. And he got upset that I didn't laugh at his joke and he left. Well, then after I finished doing what I needed to on the line, I was walking down the hall and saw another higher up supervisor. And I asked him, I said, hey, why are they blacking out these windows? He said, I think for light test purposes. And I said, in a group lead office that's too small to even bring a table in, that they're doing just paperwork in, you don't need the lights off in there to do paperwork, you know? And then I said the other lines, well, that makes no sense for these lines either because of this reason or that reason, which being at the time was they were non-operational lines that were being used for rework purposes at the time. And so I was like, that doesn't make sense either. And then he kind of looked around and goes, well, the FDA is coming next week. And it was the last visit they did before the EUA was rolled out.
Let's have a look at the other evidence that you've got here. Thank you, Melissa. What other documentation did you came that raised alarm bells for you?
Yes, I have these PowerPoint slides that talked about the COVID-19 vaccine safety update. Mm-hmm. That to me shows that Pfizer was expecting a large amount of deaths in the long-term care facilities of residents that were vaccinated, and that they knew ahead of time that this vaccine was going to have high adverse reactions, but they still rolled it out anyways. So in this, it talks about by December 31st, the first dose of vaccine was administered in 118 facilities among 7,006 residents. Assessed a 7-day mortality rates among the vaccinated and unvaccinated residents, as well as 17,076 residents in the 166 facilities that started vaccinating after January 1st. So they only did like a 7-day study. Here's the next page here. And it says, expect 11,440 deaths out of the 1.3 million long-term residents that were vaccinated over a 29-day risk period from December 21st to January 18th. They were expecting 11,440 deaths following vaccination.
Following vaccination. I think that's the bottom line there.
Yeah. And then by comparison, VAERS received 129 reports of deaths following the COVID-19 vaccination in long-term care facility residents through January 18th. So just in this 29-day risk period here, that they're talking about, there was just VAERS reported, which we know VAERS is a very, very small report system. It's not fully accurate in the case of numbers, but they had 129 just in the 29 days.
Right.
And then they call them temporarily associated coincidental events.
Coincidental events. Okay. It's absolutely ludicrous. Actually, it would be funny if we weren't talking about people's lives here. This is just insane.
Yes.
So put it into context. My understanding is that if there are any deaths or mortality that has been shown to perhaps been from any vaccine in previous times, if anything in excess of 50 deaths or very large reactions to this, everything's put on halt. Is that correct in terms of normal practice in terms of the pharmaceutical industry?
If I remember correctly, there was a vaccine that had 35 deaths within so many years, and they pulled it.
Right.
It may not have been a vaccine, but it was a product, and they definitely pulled that, which I thought was really odd considering this was in such a short time too that they had that they just let it go.
And when you say they being Pfizer or they being the FDA?
Both. To me, they're the same.
Right.
Ever since working there and seeing how they dealt with the FDA, there's no doubt in my mind that at the very least, the FDA looked the other way.
Okay.
Right. Okay. You mentioned something on nanotechnology. Let's explore that a little bit. You've said that this does contain that. Do you have documentation on that?
Okay, so this is like one of their scripts, is what I call it. It's basically for when they get a question and they're supposed to refer to these documents as how to answer.
Okay.
And in it, Nanotechnology Characterization Lab was established in 2004 as an interagency collaboration among NCI, NIST, and FDA, dedicated to cancer research and now temporarily open to COVID applications. So this is the discussion on nanotechnology. So it's basically saying it was once dedicated to cancer research that has now been open to COVID applications. So the use of COVID.
Okay.
Most people
Studies that they're doing.
Let's put this in context. Most people won't know what nanotechnology is. Can you define that for us?
Well, to my understanding, it's microscopic, tiny, nano, very, very small pieces of robot, like robots, parasites, if you want to call them that too. They're just very small man-made structures that are developed and made in order to carry out a purpose.
Okay.
Melissa, is there any other evidence you want to show us?
I would like to show something kind of odd. I wouldn't necessarily say it's evidence, but it is something that's alarming to me. So this virus, I believe, was man-made and leaked in Wuhan, China. And here we have proof that this was a document in the Pfizer database. You can see at the bottom it says Pfizer Confidential, and you can see that it's a Wuhan, China document. And Pfizer has a Wuhan Research and Development Lab in Wuhan, China, and its address is 666. And this particular document talks about responding to certain events if something goes wrong. It's the Global Business Continuity Plan, and it's developed for country-specific operations for the business process managed within the global BCP. Its recovery procedures for disruptions are documented. And if you look over here on the right, it talks about get the facts about the business disruption event. So like the events that disrupt the business. It's just odd to me that Pfizer had a research and development lab in Wuhan where this came from. And then down at the bottom in this red, it says colleagues should never talk to the media.
Wow.
Let's dive in on that just a little bit more. And Senator Malcolm, I want to get to you in just a moment. There's another, you mentioned that Pfizer was constantly changing their non-disclosure agreements with employees at the time of the rollout of the vaccines. And you weren't just being asked to sign a new one constantly, but your colleagues were too. What was being changed in that documentation?
Well, I actually saved it, but it would probably take me a minute to find it. But what they were doing was they were changing their social media policies, their media policies. They were changing how to deal with people outside of work, not even on social media. Don't talk to anti-vaxxers is literally what they were telling you. Do say that you're a Pfizer employee. Do say good things about Pfizer, but do not talk to anti-vax and do not say anything negative about Pfizer is essentially what it says.
Here at Ed Radio, we're actually all about free speech. So whether it's speech you like or speech you hate, I strongly, incredibly, vehemently believe in someone's right to say it. And the fact that that company is trying to control your speech and who you can talk to and what you can say, it's almost like they've got something to hide.
Well, here's the thing. Yeah, if you have nothing to hide, you hide nothing. And you should, even if you have a crazy employee who's out there telling people that the vials glow and that there's graphene oxide in there, you as a company are responsible for either disproving that claim or getting the supposed their truth out there. But
Sure.
if you have something to hide, you're not going to do that, which I have yet to see Pfizer do, which is issue a statement on the things I have said or that other people have claimed about their vaccine.
Senator Malcolm Roberts, what's your response to the evidence that Melissa McAtee has provided today?
Well, I need to ask some more questions if I can, please, Derek.
Please do.
Because I have to make sure my statements are backed by solid science or objective measurement or observation. Melissa, let me just check. I think I know the answer to this question. Have you been injected with the COVID injections?
No.
I didn't think so. Right. You've seen it. Okay.
Yeah.
What are your qualifications? Academic
my qualifications at Pfizer.
Your academic qualifications, your background.
Oh yeah. No, I only had 1 year of psychology major at a community college before I didn't go back and decided to dedicate my life to working in big pharma, because within the big pharma plant, such as Pfizer and Hospira, where it originally was before they bought it, was you could move up in the plant. They do all their training in-house. And so if you work there 10 years, you have the ability to become a supervisor. You know, there's a chain that you're able to work your way up, make more money, get more benefits, things like that. So I don't have anything out special when it comes to science or biology education.
Okay, thank you for that. What training have you had within Pfizer?
Visual inspection training is a yearly thing they do. It takes anywhere from 2 weeks to as long as 6 weeks. It's where they give you different configurations of units, such as vials, carpijects, ampules, syringes, and they give you hundreds of good product and some bad ones, and you have to find the bad within the good in order to pass. It's very tedious. It weeds people out that shouldn't be in the job very easy. Each job, it doesn't really matter where you are within the plant except packaging maybe. It takes about 6 months of training to become comfortable in your position, because we deal, especially in quality, because your job's changing I would say weekly, your job can change. You have to be up to date on trainings every day. They do all their own training within the plant. So like you have to become aware of everything that can happen and everything that can go wrong so that you know how to address it. And so.
Great. Thank you. Excuse me. I also noticed that you said very much up front that people care, and that's my assessment of most humans, that they care. And you said you're part of helping save the world because that's what you believe. So you came in ready for the Pfizer bullshit. And then you woke up during that process.
Yes.
Okay. And you said quality was sacrificed. How are they sacrificing quality?
So things that they hammer into your brain from the beginning is if it wasn't signed for, it wasn't done. Things like that. Or if there's a missing signature, a missing date, a missing check mark, it is serious. You either have to prove the event happened, or you have to redo it, or the batch gets thrown away if it's something as serious as affecting a batch. But for example, I was noticing, like when I said I got skeptical in 2019 of their ethics, they wanted me to sign off on a product that was missing visual inspection markings to show that the product had been observed and inspected by people. So a product that has never been seen, they wanted to send out to customers. And wanted me to sign off on that, and I wouldn't do it. And it took about 3 hours for them to go up and type up a document that says I'm not responsible if anything happens, basically just to get the product out. And that was pre-COVID. So after COVID, if somebody I knew who was directly over the vaccine, who was management, if they got a piece of paper on their desk and it's the COVID vaccine and it's missing signatures, they were told to just sign it.
Okay,
that is a huge deal.
That's extremely important, because what you've just given us is an awareness of the way they bypass processes. So that means their processes are not worth the paper they're written on.
Correct.
Yeah. Okay. Thank you. And I must acknowledge your courage in doing that, because quite a few people would have just submitted to their boss saying, "Yeah, I'll sign it." You know. So
I'm pretty hard-headed, and I believe in quality. I loved the job. I liked the job, so I was very serious about it.
I think you're also aware, more importantly, that your integrity is the only thing you leave behind is your legacy, and that's fundamental. So thank you so much for doing that. Not everyone would do that. Oh, by the way, Derek.
Sadly, I'm learning that too.
Sorry?
Sorry, I'm learning that too, as a lot of my coworkers are still there. So. Yep.
So you're no longer at Pfizer?
No, they fired me after my whistleblow.
Okay. Can you tell me about the whistleblow, please?
Well, when I found the documents on August 20th, 2021.
Which documents, Melissa? Which documents?
A lot of documents. I would say over 150.
Okay.
Some I've shown you today, some I haven't. But it's just different trainings, like in PowerPoints, different discussion pieces, emails, sciencey stuff I don't understand, like the makeup of the vaccine, things like that. I found the emails in layman's terms because, like I said, I don't really have that scientific background, but I can read plain English. The emails made me sick to my stomach. I showed you one of them, the graphene oxide ones, but I took a mental health leave of absence that day so that I could look into these things to see if I was just being crazy or if I actually found something that to me proved Pfizer to be sinister. I was on that mental health leave. I reached out to a group called Project Veritas after reaching out to any news source that I could, not receiving a response from them. Some friends sent me Project Veritas. They got back to me in about 15 minutes or less. I had to prove who I was, but within about a week and a half, they had me flown out there for the interview where they decided to release the aborted fetal cell line emails, which is about 10 emails or so where they discuss wanting to keep from the public the knowledge of the aborted fetal cell lines being utilized in the development.
So you're not a science expert, you're not a scientist, but what you've done is you've relied upon the fact that this is vaccines, all medications that enter someone's body must be through a very rigorous process of quality control. Pfizer has bypassed that.
Yes.
So that's one thing, and you don't need to be a scientist or a biologist or a doctor or a medication specialist to know that. That's fundamental. So you don't need any qualifications in science or medicine for that. And you've also got hard evidence from some of the documents.
Yes.
Right. Okay, that's pretty hard to beat. What I understand is that we run 2 COVID under question inquiries here in my office with people from members of parliament from other parties in the last 2 years. And one of the things one of the people we've interviewed at that inquiry was a man called Dr. Philip Altman, who has 40 years working with the TGA, our Therapeutic Goods Administration. They're the equivalent of your FDA. They approve or not approve drugs, right? He's also run his own company working with big pharma. So he knows the industry inside out. He first started becoming, we introduced this topic to him, and he has just got a voracious appetite for facts and data, and he's done a marvelous job. So I just thought I'd mention that, but he introduced us to someone else. I can't remember the man's name, Jim someone, and Jim has similar experience, 40, 50 years with big pharma, with many different companies in big pharma, and I think in Europe, but he's an Australian as well. And he said that this is not made to good manufacturing processes. Not at all. And that's fundamental. And we also have huge variability in the impacts of the so-called, I won't call it a vaccine, I call it an injection. It's an experimental gene therapy based treatment. But yeah, I don't know if you can see this here. I can't see it when I'm...
I can see it.
That's a graph along the bottom line here. That shows the number of adverse events, I think, number of deaths for major drug vaccine recalls. These over here on this line, whoops, I can't work backwards. These over here were recalls.
Wow.
And look at the number of deaths. This is Pfizer, not recalled. Sorry, COVID vaccines, not recalled.
Yeah.
It's just staggering.
Which alone, that email I showed you where they admit that graphene oxide could be in there from other manufacturing components, that is worth a recall or investigation alone. So
yeah, well, I was going to question you about that. If they can't, I see what you're coming at, and I agree with you. They cannot give you an assurance that there's no graphene oxide in it, so it should be stopped. I get that.
Well, the way they're framing it up is like they can't guarantee you there aren't flies in your peanut butter. It's kind of how they're like framing it up, like, oh, if it's in there, it's not our fault. It just, kind of came in there through other means.
That's not evidence there is graphene oxide in there. It's just evidence that there may or may not be graphene oxide
and
in
that
there.
they want to omit that from consent, the knowledge of people, so that they can give their full consent.
And that's what's gone on all the way through this whole COVID mismanagement. It's gross mismanagement. It's gross deceit. It's inhuman deceit. They've been killing people with this stuff, that they've wanted to hide things from people. If you've got a good process, if you've got a good product, you are completely open. You don't need medical qualifications, scientific qualifications, biological qualifications to know that, and you've shown that. So thank you so much for what you're doing. Have you had any threats?
Just trolls on the internet, people saying mean things, but nothing serious. Pfizer still harasses me to this day. A year later, after termination, I've gotten 2 calls from them just in the last week or 2. They say I owe them $900 in overpayment, and I haven't heard from them since they fired me, but they've reached out just in this last month to try and collect money from me.
Right.
Is that to put pressure on you?
Coincidentally, it was right after an interview came out when I've picked them up again, but I don't know, because I do know other previous employees who reached out to me that said they also got the same letter, just different amounts.
Okay, all right. So they're making $100 billion in revenue. And they want to chase you for $900. Okay.
Yeah.
You mentioned that the injection, the fluid, came from China. So we don't really know that, other than it had Chinese writing on it, right?
Yes.
Okay, so I couldn't imagine why it would have Chinese writing on it unless it did come from China, but we don't really know that for sure. So there's some uncertainties. The other thing was, it may be different in when you're with the vials. To me, the vials looked as though the fluids were cloudy, not glowing. That may be because of the camera and everything.
Oh, yeah. I wouldn't say that it glows like you could light a room with it. I would say that it glows in the sense of, like, have you ever seen a glow stick, and when you crack it, it's real bright, you can shine it in the dark, but then after like a few hours, it kind of dims to where it still is glowing, but it can't like light up a room? I would compare it to that. It's not glowing like a flashlight glows. It's not glowing like a lightning bug glows, but it definitely emits its own.
So the word is emits. It emits some kind of
a light, a glow. It like produces some kind of thing. And it color shifts too, which we'd never seen. Nobody I worked with in that plant had ever seen that.
So people with many years of experience with Pfizer's products have never seen anything like this.
Correct, and multiple pharmaceutical companies as well, not just Pfizer.
Okay, that's a good point. So that there are serious questions that need to be raised, and we know already from someone with decades of experience with big pharma and manufacturing that they don't comply with good manufacturing processes. There's huge variation in the product itself from what we can see. Some batches have huge numbers of deaths and other batches have nothing. And so what would seem to be the case is that when they're scaling up from the test facility, testing or the trial run in the product manufacturing, when they have to be very rigorous. When they're scaling up from manufacturing, they've lost control of the variability. That would seem to be the case.
Well, and if they're getting their solutions, such as, because people have asked me, are there placebos? Every vaccine I saw behaved the same way. There weren't some that did, some that didn't. They all did. So to me, I wouldn't say it's placebos. I would say there's more toxic batches and less toxic batches because they're, like you said, and I've said there's not been any safety protocol quality assurance in there to guarantee that every batch is the same. We don't test it the way we test other things. And that is just a huge red flag to where I think the people should know that before deciding to get it. Sadly, it's been 2 years, but they're trying to give this to the children now, at least in my country. And that's why I fired these interviews back up again and wanted to get it out there, because you need to know. I mean, if an adult wants to go get it, go get it. But these kids, little kids, trust their parents. So they need informed.
Well said. Very well said. So what we've got, without talking about the injection material itself, what we know is that the fundamental process, they're bypassing product quality controls.
Yes.
That's enough to stop it right there.
Mm-hmm.
What we've also got is you being censored and other people in Pfizer being censored. If someone has a good product, the employees can talk all they want, because they will reinforce the aura of their employer being a good product, good manufacturer, a very high quality manufacturer, but they don't want to do that.
No, and when I would bring issues up too, because we have a chain of command we have to follow out there. It goes to your inspector, to your supervisor, to the manager, to whatever. And I went all past, but every time I would bring up a quality issue, I would wait an hour or two and I'd hear back that it's fine. That because of the EUA, we could bypass certain things, or just simply just move on, forget about it.
So they wouldn't come back to you with a response in terms of, well, this is what we found. It's either your question or your complaint is not valid, we're just continuing, or there is merit in what you're saying, and here's what we've done to fix it. They never came back.
They never fixed anything. No, it was just move on, forget about it, or it was, it's allowed right now.
Yeah. Okay. That sounds like the way quality was treated in some American companies with products, physical products like motorcycles or cars, and that those companies ended up collapsing and had to be revived back with proper quality control. In this case, in their case, it was a matter of those companies go broke. But in this case, people die.
People die, and Pfizer just keeps getting more money and making more vaccines.
Well, what we've seen throughout this whole virus mismanagement, it's been gross mismanagement. We've seen three words: deceit. There's been deceit after deceit after deceit from politicians, from scientists, from some health bureaucrats in our country, from the media. We've seen active suppression of information, active suppression of people questioning. But we've seen deceit and cover-up. The second thing we've seen is a massive wealth transfer. The third thing we've seen is this has been used to control people, control what people do, how they move, what they say. Now, we don't know from your material whether there is gene technology. We know from Pfizer's disclosures that there is gene technology, but we don't know from your disclosures if there's graphic oxide. They just want to cover up the possibility. You've also told us that they knew of the adverse effects. They knew it well in advance. And as you pointed out, 129 deaths is much less than their 11,440 that they anticipated. But the fact that they're anticipating so many deaths is a real concern. I mean, they're basically murdering people. It's genocide. So instead of Anthony Fauci being on his own committing genocide, he's now got Pfizer potentially doing it too. But the fact that the VAERS data, some people say it could be just 1% of the actual events is being reported. Some people say it could be 10%. But if it was 1%, then the 129 deaths would be 12,900. Just multiply by 100.
In a short time. In a short time.
Yes, and that was your point. 29 days, I think you said.
Yes. That
That is phenomenal. So they are expecting that. I'd love to see the paperwork, and so would, I'm guessing, Brooke Jackson's lawyer. The fact that they had a lab in Wuhan, I mean, there's nothing wrong with that, but why hide it? Talk about it. And I've never heard that before.
Yeah, a lot of people haven't. A lot of people also don't know that my plant specifically, I don't know about other ones, but my Pfizer plant was producing and manufacturing remdesivir. But we would leave them unlabeled and you ship them to Gilead, and Gilead puts their label on it, but it's made by Pfizer.
So Pfizer made remdesivir.
Yes.
That's one of my staff. He's a very, very effective researcher. I thought remdesivir was sold by Pfizer, and he said no, Gilead. Now we've got the fact that it's made by Pfizer.
Yes, and that was actually originally what I thought was the vaccine, because its code was COV3016, and we dealt with that for quite a few months, and then we found out, oh, that isn't the vaccine, that's remdesivir, and then we got the vaccine.
I'd like to also, there's another point here that I'd like to raise, and that you noticed, Melissa, there was a change in the labelling of the vials for the COVID-19 vaccine that was different from the standard practice of Pfizer at that time. Can you just go into how that was different too, please?
Yes, and I have pictures of that as well. Let me pull it up. But this here is a regular 5 milliliter vial that is produced. Like, this is where the label goes on it. There's enough space on top and on bottom, and there's also a gap in between the label ends. And this is so that if a defect is found after packaging, that instead of wasting the man hours to peel every single label, that quality is able to go in there, re-inspect the product for other defects without having to unlabel it, essentially. But when I walked down onto the line, this is what they looked like, which... as you can see on here, it does say that this is the emergency use biotech COVID-19 vaccine. You can even see the lot number and expiration date. But the label placement, you can see how low it is on the shoulder of the vial and leaves almost no space at the bottom. And it's even got a thin gap between the label ends. And this is the container they get shipped out in that you can see around it, this white. So again, you can't see any of that glowing that occurs with the dark backgrounds. It doesn't glow on white, and that's it. And when I asked the line, why is the label so low? We have literally had to peel and recall and get sent back vials to peel them all to put labels in better positions. That, like, it's a big deal sometimes. And so when I asked this, they said, this is how we were trained to do it. I said, okay, do you have an amendment protocol? Do you have a third-party request? Do you have anything written that says this is how these labels should look? And they said no.
And that's important in terms of you as a quality inspector being able to see if there is a defect within that that container. Is that correct, that vial?
Yes.
But it also
if it gets out, if it goes out and it's a problem and my name's signed off on it, I'm the one in trouble.
Right.
Yeah, it also shows, Derek, that they don't stick with procedures and processes. They change them without recording them, without documenting them. So we don't know the chain of accountability in the company.
Yes.
For things that are going into people's body and potentially killing them.
It does.
Especially when you see that everything else is so heavily regulated, if you like. It's all organised. It's very, very. There's a chain of command. There's a chain of how to do everything. There's a quality assurance sort of process.
Everything's documented.
Yeah,
usually.
absolutely.
Everything down to the people who have touched it.
Right.
It's documented.
But just on this particular product, just decided different rules, right?
Yep. Pretty much just mainly this product. Like I said, the only other time that I questioned their ethics was in 2019 with the other product, which was a morphine product. It was either hydromorphine or morphine. But either way, when they were trying to bully me to get it out the door, I was like, seriously? You know?
But I just wanted to say, Melissa, thank you so much for what you're doing. Your courage is amazing. Your integrity is right there. So thank you. Your practicality, your common sense, and your sense of integrity and courage, just really, really appreciate it. So thank you. And if we can support you in any way, let us know.
Melissa, I have two more questions for you. First of all, what's your motivation for doing this? You're taking incredible risk here. Why are you doing this?
Well, there's really two reasons. One is because I fear the Lord and I truly believe, I am a Christian. I believe that I'll be held accountable if I knew this information and didn't get it out there. And secondly, children, innocent babies that they're trying to get this to, that solely rely on the education of the parents, and the parents aren't receiving that informed consent. And it scares me that we could be either killing an entire generation, making them infertile, or possibly giving them life-altering disabilities.
I'd also like to ask you, Melissa, what would you say to people who are experiencing vaccine regret? I wish I hadn't have taken it. What would you say to them?
I would definitely, and again, I'm a Christian, so this is what I believe, is to turn to God and repent. Once you come to the knowledge of the truth and you show remorse and regret for that, there's grace and mercy for that. There's, I personally believe, because my whole family got vaccinated, but yet they haven't had any adverse reactions. They're totally healthy. I fully believe that's because, you know, God is taking care of them for me, from my prayers. And so I personally believe, I haven't looked into things like detoxing or anything like that, because I think we have a God that can heal anything and anybody. So I think that if they're experiencing that and they're scared, they should turn to God.
Can I just jump in there, please, Derek?
Absolutely, sir.
Okay, thank you. Yes, yesterday I asked questions in Senate estimates hearings, and Melissa, what that involves is bureaucrats and ministers, what you would call secretaries for departments in America, come before the Senate, and we take turns in asking questions. We follow a line of questioning. So there was a topic I raised with the chief medical officer, who's a bureaucrat, and the first topic was births, live births, and the second topic was deaths. The first topic, births, I'll just show you. You won't be able to read that, but that's the birth data for various years, 2012 through to 2021. Now, our Australian Bureau of Statistics is way behind in terms of releasing the births. They usually don't do it until the end of the year. Okay. What we've seen is that 2021, the first half of the year, births were pretty much the same, maybe slightly above the average. Well, that makes sense because men and women were locked down together, yes, and they had 9 months earlier. Now we got a lot more births in the first half of 2021. But in the second half, every single month, July, August, September, October, November, December, every single month was below average. Now, you would expect some above average and some below average. Every single month was below. But so we get about 24,000 births a month. In November of 2021, a year ago, there were just 18,000 births. That's pretty substantial decrease. In December, wait for this one, there were 6,500 births. That's almost 3/4 down, almost just on 1/4 of the normal rate for December. That is really scary. So what we're seeing here, and what you'll notice is that the last 6 months were the impact of the vaccines. Not COVID, but the impact of the vaccines on people. So other nations have now started publicizing this kind of dramatic drop in births. We've had exponential increase in stillbirths, exponential increase in failure to conceive and miscarriage. This is really serious stuff for the whole species, the whole of our humans around the planet. So births have plummeted in the last month of 2021 to 1/4 of the normal rate.
That's huge.
So we're starting. What my point is, what will we see after this year ends, and we see the birth figures for this year? And then the chief medical officer tried to dismiss that, but I understood the data, so he wasn't able to. He doesn't know what the hell is going on. And then if you see the death data, we then move to the death data. What we can see is there's a band of deaths. You know, every year is not the same, so you expect a band. For the last 15 months, the death data, all-cause mortality, has been consistently above that range of normal range of deaths. And they've had 2 huge spikes in the numbers of deaths after the 3rd and the 4th boosters. And my point is this: we know that these injections, these experimental gene therapy-based treatments kill people. We know that. We also know there's a short-term effect. Dr. Philip Altman told us that. So many of the deaths occur within 48 hours or within 3 days. But they're now occurring months later. So we have done no short-term testing other than releasing this crap into the public. That's the test. We're the guinea pigs. The federal health minister, the Secretary for Health in this country, he said, the world is engaged in the largest clinical vaccination trial. It's experimental, right? It's experimental, yet they're inhumanely imposing it on people, forcing them to lose their employment unless they get it. So what we know is that experimental, it's been used to coerce people. So these all raise serious questions, but we also know that there's been no long-term testing, none at all. And even the short-term testing has not been complete. It's only been partial. They haven't done genotoxicity, they haven't done carcinogenicity, they haven't done tests on pregnant women to the extent they should have. They haven't done as many tests on animals. So what I'm saying is we have yet to see the impact quantified, medium-term, long-term, because there's been no testing. We have gone, normally, Tess Lowry says that a product like a vaccine has about 7 to 10 years of testing to get the effects. This is a new technology. She said it should have 15 years of testing. Instead, we've had not even 15 months, not even proper testing. Your former employer, Pfizer, screwed up the tests.
Well, supposedly, they only did 2 months of inhuman study, and it might even be less than that.
Yeah. So thank you so much for what you're doing. I just thought I would give you some vindication that in Australia, we're now starting to see enormous decrease in births and enormous increase in deaths. Never seen before in our country. Never.
Senator Malcolm, what would you say to people, Australians who are wanting, well, have gone through the losing a relative, seeing those who've suffered from perhaps pericarditis or myocarditis, those who have, weren't there when their relative was passing away, people who are concerned that their freedoms are lost for their children. What would you say to Australians right now?
The first thing, I'm a Christian. I don't go to church, but I follow the teachings of Jesus Christ, and he taught us about grace and forgiveness and love, the true source of love, grace and forgiveness. So I would say, first of all, forgive, in the true sense of the word. Forgiveness, as it's been taught by the church, in some churches in recent decades, is about blame. That's not true forgiveness. True forgiveness is where you just don't have any value judgment about someone. You don't blame them for things. You just look upon it as just a fact. So no value judgments. Try not to have value judgments or hate, because if you hate, it creates more pain in the hater, right, Melissa, than in the person receiving the hate. So
yeah, that pushes them further.
Sorry?
It pushes them further from anything you're trying to accomplish.
Right. So remember, forgiveness and compassion. These people, the second thing is, these people have done this perhaps deliberately, which means we have to get to the bottom of it, but certainly through, at the very best, through very poor management or very lack of integrity. So we've got to make sure that we round them up. And so I just want to reassure people that we will continue our efforts to round these people up. Now, yesterday, Derek, in Senate estimates, there were 3 of us asking questions about holding people accountable. The others were still asking questions about when's the 4th booster coming, when's the 5th booster coming, what are the injection rates? I mean, this is just insane. We've had 2 years of these lies and insanity, and deceit, and we've still got members of Parliament, decent members of Parliament, asking this rubbish. So what I would say is, first of all, have compassion. Secondly, empathize with yourself, because if you've lost a loved one, that is pretty hard to get over. And it's very hard to get over if they have been killed. An accident is one thing. Death from old age is another. But being killed by deceit and fraud is another. And the third thing is, be reassured, I won't stop until we bring these people to justice.
Senator Malcolm, I want to thank you for your time, your courage, and what you're doing in representing the Australian public. Melissa, wow, thank you for your courage in speaking out, in particular with personal risk to yourself. Thank you so much. If there's something that people can do to support you, Melissa, in particular, is there anything that they can do to help you?
I do have a Give, Send, Go. It's givesendgo.com/Pfizer Whistleblower. Okay. All one. Anything, whether it's prayer or a monetary donation, really helps. Whenever I'm having the rough days, I go read the prayers. Anything helps really right now. And just also sharing the content, sharing the interviews, taking screenshots, sending it to your loved ones, doing anything people can to get it out there, what I show, because it may just change somebody's mind.
Make no mistake, Melissa, we will spread this everywhere. You will be heard. Your bravery needs to be acknowledged, and we're going to make sure that everyone on the planet sees this. It's as simple as that. Incredibly proud to be part of this. Look, here at Edge Radio, free speech. It's safe and effective. That's all I've got to say. Okay. We've had
better than any vaccine.
Absolutely. And as I say, we really push the point here is, with the media in Australia, across the world, we've had so much control. We've had financial control, let's face it, from the government when it comes to taxation and so forth, which has stopped the media from doing its job. So we will certainly use every avenue that we've got to make sure that your voice is heard.
Thank you.
Our pleasure.
Yeah, and in addition to complimenting you sincerely for your integrity and courage, I want to compliment you for the fact that I can see you're a beautiful soul, and you really are an amazing person. Thank you so much for what you're doing, Melissa. For
thank you. That means a lot to me, and thank you too for what you're doing.
Well, that wraps it up. Thank you both for joining us, and thank you for listening. Hey, do us a favour if you got something out of this today. I mean, gosh, spread the word. That's the huge message here. People need to know there's been so much censorship on this issue. We want the truth to come out. And we would appreciate you spreading this and telling someone about this if you've gotten value out of this story. Thank you so much. We'll catch you next time at Edge Radio Australia.